In the ever-changing world of healthcare, are you looking to get advice and learn to prepare for healthcare challenges that you may face? Come join a conversation about all things healthcare and wellness with your hosts, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.
Welcome to the Healthcare Corner, everyone. And today we've got another exciting topic, and it's going to be another quick hour. Guillermo, how are you doing today?
I'm doing great, Gavin. You know, other than this time change, I still don't understand. Maybe before we get into today's topic, I really would like to talk about this time change. I know the daylight savings has been a tradition for a long time here, but I still don't know why this day and age that time has to change, because it completely throws me off.
Absolutely. And kind of in this whole global business environment, right? Like we've got partners all over the country, all over the world. So yeah, why are we changing it every so often?
I think we should always keep it at daylight savings. We should have as much daylight as possible.
I agree. It's going to help us with baseball as well, which is super important. So you know, today you've heard phrases like by the skin of your teeth, more than one way to skin a cat. Beauty is only skin deep. And so I think we're going to talk a little bit about the largest organ of the body and kind of how that contributes to our overall health and our health span, and just kind of tie it all together, Guillermo, on what we've been talking about the last couple of weeks.
Yeah, I think that the largest organ in the body is something that most of us take for granted and don't really appreciate everything that it is, number one. Number two, what it does for us. And number three, we don't appreciate it enough to really protect it. So it's really interesting to me that, you know, today we're going to really get into the actual details of what really the skin is. Is it really an organ? And why is it the largest organ? And why is it so essential? And more importantly for me is, you know, there's a lot of damage that causes. There's a lot of insults that we actually ourselves inflict on our own skin. And, you know, we're going to talk about which ones are reversible and which ones aren't. So that please stick around at the end, because it's going to be really exciting. And it's something that's really going to contribute to your overall health, as Gavin alluded to.
And this is something, in full disclosure, when I first came out of school, I did pharmaceutical sales and worked with a dermatology company. So I'm going to kind of have some insight there. And Dr. Shah, it's great to have you as well on the show to talk about all things skin today.
Yeah, I'm really excited. It's actually one of my favorite topics. So let's dive into it.
Absolutely. So I think when it comes to understanding our skin, we all have different types of skin. Some people have really dry skin. Some people have oily skin. Some of that seems to be maybe genetic or regional or whatnot. And I know when I was working with dermatologists, when it came to addressing some issues of the skin, particularly acne, if someone had oily skin, they'd want to dry out the skin. If they had very dry skin like myself, then they'd want to add humectants and different things to make the skin more moist and supple so that it wouldn't cause that acne. So I think we want to kind of cut through some of those just standard ideas and get down to the heart of it. So, Guillermo?
Yeah, I believe that, you know, a lot of people have this very superficial idea, didn't mean it as a pun or anything, but skin is a very superficial idea of what skin is and what it does. So that, you know, we're very used to, especially in the world of aesthetics and actually our world of being very, from a society standpoint, being very aware of what our appearance is on the surface, but not really understanding what really the factors that really affect that appearance. And we're very used to, you know, putting on, like you said, cosmetic, whether it be lotions or any type of actually makeups that people use, right, to make their skin look smoother or to look. But ultimately, you know, as Dr. Shah has told us many times here on the show, when it comes to root cause effects, and this is the skin is one of the most important places where you should really look at what the root cause of the problems are that you're facing with your skin, so that you can really make a difference long term. And when you use that, say any topical agents, it's just to really make it, you know, just to finish off. It's almost like a finisher it's almost like putting a coating on your car, right? Once you paint it, it looks really nice, and you put a coat to protect that coat. And maybe that's what we should be using these topical agents at, not as a way to treat some of these issues.
I so echo that, Dr. Guillermo. I, tell all my clients and patients that skin is a reflection of your internal health, and it's the largest organ we have. That means all your toxin overload is coming through that, because it's the largest excretion organ also.
Yeah, you know, and most of us don't know even the components. So maybe this is a good time to really get into what really is. Why is it the largest organ? Well, number one, it has to cover your entire body, right? So we know that. So it has to be the largest organ. It's also comprised of a bunch of different other derivatives of the skin, such as hair, nails, glands, and specialized nerve endings. And most of us don't know this, but it's made out of mostly, I mean, I guess we did learn this, right? I remember learning back in science in elementary school where they tell you that your body's 85% water or something like that. And obviously that percentage changes as you get older. You get more fat and less muscle and less water. Yep. You know, but also proteins, fats, and minerals. You know, and you know, most of us, I'm not so sure. Even if, I mean, this was actually a review for me, because although I knew there was 3 layers, I didn't really know that what those layers were made of and why that's important. Do you guys remember learning that? I know, Dr. Shaw, if you remember learning that, obviously you did, maybe when you were in your graduate studies, and as a physician, you probably know this. It
in undergrad, and I had it in postgrad, both, because we have different chapters and block systems, right? So let's dive a little bit into the structure of the skin. That way we can really help our audience understand that.
Yeah, and you know, Gavin and I were having an interesting conversation, because obviously, you know, on the superficially we look very different, right? I mean, I'm darker pigmented skin, and Gavin is lighter skinned, and he's like
freckles
with freckles. Okay. You know, he's
typical ginger.
Yeah, you know, beautiful ginger that he is. And I was like, look, regardless of what our regardless of what our skin color looks like, you know, really the components are the same. Right. So that's what we understand. We all really are the same. And it starts with this layer called what we call the epidermis, right? That's a very top layer of the skin that you can see, that you can touch, you know, and that's made of, I'm sure many of you have heard this term, keratin. So it's a protein that's inside the scales that make up a lot of the cells that makes it feel a little bit rougher, that makes it a little bit more resilient as well. It also helps the skin, you know, really the cells stick together. And the reason for this epidermis is really, that's what acts as that protective barrier, like I already alluded to, especially from bacteria, germs, and anything that wants to enter the body. Because remember, we're constantly under attack. If you haven't noticed, even as well, you know, from on a microscopic and a microbial, we're constantly under attack. So there's always insults or you know, bacteria and bugs that, as we know, there's some that are healthy that should be on us, but there's also a lot of others that are trying to get within that skin layer and get into our bloodstream and cause infections. So this is, you know, really what protects us from that. That epidermis also is where the new skin is made. So it continually, this is a really, I think really interesting to me, is most of us probably never heard that your skin is completely replaced, all of it. Remember, it's the largest organ. We're talking about millions, hundreds of millions of cells. Every 30 days, your skin is completely replaced. So, I mean, that must blow your mind, Gavin. You're looking at me with this like dazed and confused look.
Totally. Yeah, because you think about that, and then as we age, how does that change? Because I know in the nursing homes, you like if you pinch your skin, as an example, it goes back and kind of it looks normal for us. But as we age, I know you pinch your skin. If you're dehydrated, it doesn't necessarily kind of go back to regular form. So those are some types of things I'd love to address on the show as well.
Yeah, and I don't know if you guys ever heard this, but you know, in my house, I sweep every day, like at least once a day, if not twice or 3 times a day. And no matter what, because I have wood floors, it's like I never seem to get ahead of it, right? And I remember at one point, I don't know if you guys remember this, but I read or I heard that 80% of dust in your house is dead skin cells. So I was like, man, how is that possible? Like, how can I, am I losing that many skin cells? And since the average person loses about 40,000, sheds about 40,000 skin cells a day. So when I think about it, you know, there's 4 or 5 of us, the dogs at the house, you know, I mean, that's a lot of skin cells. I guess I got to continue keeping. That's why I'm always sweeping. You know, there's also in that dermis, the epidermis, there's also this layer of cells called Langerhans cells that are that actually contribute to the immune system, and those are the ones that help fight off germs and infections, as we talked about. You know, and the dermis is also where we provide the you know, this pigment, the pigment cells called melanin, right? That gives the skin our color. Some of us obviously have more than others. You know, Gavin and I, the example. But that determines the color of your skin, your hair, your eyes, and some people just make more than others, and that's why we have different shades of people.
And I want to get back to the Langerhans cells and have you both comment on this maybe on the other side of the break. But when we're talking about the immune system, when we're talking about antibacterial soaps, how much of it is important that we actually have some natural flora to fight against these things that are attacking us, all these exposures and not. So that's definitely something I want to get into.
Yeah, that's a good point, Gavin, is I think especially now during this pandemic and where we were taught that, we couldn't touch anything. And anytime you even came, within 6 feet of anybody else, you would start showering yourself with this, this antiseptic, wash or just that, the little sprays. Everybody was carrying around all kinds of different gels and sprays.
Certainly. Yeah.
Right?
I mean, you think of like there's even different sprays that can go around a person's body to protect them for like a sphere, right? There's just a lot of different technology out there. And is that more harmful than good? That sort of thing. I'd love to get into.
Yeah. Well, for me, it's kind of interesting because, we learned in medical school and we learned across our studies that we're always exchanging microbes with anybody that you're in the vicinity of, whether you know them or not, right? So you're always sharing that. So your microbiome consists of everything and everybody that surrounds you. And as a kid, we used to play in dirt. We used to play, there's dogs in the neighborhood, cats. Squirrels, whatever it was, we were always around other things. So our microbiome on our skin was very vast and robust and comprehensive. So I don't remember getting a lot of colds and, getting sick hardly ever. And we were always dirty and we were never worried about washing our hands. We would eat with dirty hands and I'm pretty sure we would eat a lot of dirt. Yeah?
Right.
But I think, right, Dr. Shah?
Yeah, well, I grew up in India, so you guys know we're not germaphobes like there. So we're literally in the mud. We're picking out mangoes from the trees and falling from there, going home. Yeah, little practice of washing hands beforehand, before eating, that would be something that everyone should practice. But I think this whole phobia over like the germs is overkill in our country. We need to kind of change that a little bit.
Yeah, so to me, it's really interesting of how we've evolved to that. But we're gonna get over it. I'm sure this is something that's gonna resolve. But stay tuned because as we come back from the break, we're gonna get into the other layers and why the skin is so important. So don't go anywhere.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah. Welcome back to Healthcare Corner, where you're a part of the conversation with your host, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.
Welcome back to the Healthcare Corner, everyone. And I think we finished the first segment talking about a couple of important concepts of clean health and what we can do to make sure that we're not germaphobes, but we're also still cognizant of things that are potentially very harmful for the body. So what is that appropriate level and where do we kind of start with that? Guillermo and then Mansi?
Yeah, well, I think that's an individual thing. It's about feeling comfortable and knowing that you're otherwise healthy. And I think that we've been taught because of, like I said, social media and then society in general that we should be a little bit, almost hyper vigilant when it comes to with insults and these bacteria. But the truth is that all this stuff has been, almost every single bacteria and virus that's out there has been around for long before us, right? Hundreds of millions of years, if not billions of years. So how weary should we be of it? I mean, I think that, if you're immune compromised or if you're in any situation where you might not be, your immune system might be not as healthy as it should be. And for example, you're an uncontrolled diabetic or you're taking any immune suppressant medications because you've had an organ transplant or you have some kind of cancer, you're getting, chemotherapy, things like that, then you should be very vigilant. But most people who are otherwise healthy and normal should go about their day without really fearing that they're going to succumb to one of these already existing bacteria.
I echo that, Dr. Guillermo. I would say, Gavin, it's great to wash your hands before eating. If you're sneezing, take precaution. Don't sneeze on other people. If you're sick, stay at home. But other than that, honestly, if you're otherwise a healthy individual, you should not be scared all the time and just kind of lead a normal life and go out and soak in the nature, like the microbiome that we get from the nature that we, see around us, especially the trees and different, hikes and all that. Like, that's really important for our health and well-being. So I would say that we need some bacteria really, and we need to avoid some. So you just have to have healthy practices.
Great. Yeah, I completely agreed, Dr. Shaw. And, getting back into, what other components of the skin, really, we went from this epidermis. Now we're going to get into this dermal, the dermis, or the middle layer of the skin. And, this, interestingly enough, makes up about 90% of the thickness of the skin, because it has some of these more robust proteins that are in there, for example, collagen and elastin, which is, the stuff that makes up the skin cells and makes them very strong and resilient. It also is the flexibility. So if you notice when you stretch, right, when you're doing exercise or you're stretching, or your skin kind of stretches and it doesn't just bust open, even though sometimes it feels like it's going to, right? Sometimes I'm working out so hard, Gavin and Mansi, that I feel like my chest is going to bust through my skin, but it never does happen. Yeah. Maybe that's all in my head.
Thankfully.
So it's not going to happen.
But this is also the layer that, grows hair, has all the hair follicles in it. Also, it keeps, the nerves in the dermis, all the nerve endings that are usually in that middle layer. And some people, even though that we're so sensitive, right? We use our skin has a lot of nerve endings, obviously, for temperature and pain and all these things. It seems like sometimes we're very sensitive, but you would think that they were right up against the surface of your skin. But obviously, most of those nerve endings are in this middle layer.
So I go back to my time with the nursing home, and you look at different pressure ulcers, you look at staging of wounds, and understanding that sometimes wounds are so deep you can't see a bottom, so they're unstageable. I know that probably both of you have had a lot of different things that you've seen in the hospital, and how important is the skin relative to keeping somebody alive? I know we were talking a little bit over the break about sometimes how challenging that is with big wounds.
Yeah, I was sharing with these guys that, I did, when I was in residency, I did 2 months in the burn unit in county hospital. And it was really impressive to me, that when, the people that would come in with, say, 80-90% of their body surface, sometimes more body surface area that was, in third degree burns, meaning, third degree meaning they went to the full thickness of the skin. And so they basically had no more skin on their body. And I recall there was one night where I was on overnight, and I was taking care of this gentleman, this young guy actually, who came in after a meth lab had exploded of his own doing, and sadly the guy had lost, I think, 95% of his skin. And in one night shift, I gave him more than 60 liters of fluid IV as quickly as I could, and I still couldn't keep up with his fluid needs. So he was just losing so much fluid. And that's one of the reasons why, right? The skin is actually keeps you from dehydrating. So not only does it keep a lot of the musculature and the vessels and everything in the bones and everything protected and inside, but it also acts as a water non-permeable barrier that keeps the stuff that's supposed to be in and the stuff that's supposed to be out. And if skin's doing what it's supposed to, if it's not compromised, it's exactly what it does.
Absolutely. And collagen is such an important factor that we stop making after about the age of 30. So that's also in this layer. And it is such a huge factor that we have to start supplementing at one point. So there's so many caveats to all these different layers and how the skin can actually really be one of the most important organ that keeps us alive. As Dr. Guillermo, I've seen some diabetic patients with cellulitis and also, maggot infestations and all that, and they end up getting amputated because of skin being gone. So I totally echo that thought here, Dr. Guillermo. It's one of the largest organ that is so vital, and we have to keep up with taking care of it internally, as gut health is reflective of skin health.
And it seems to me that when you're looking at all the aesthetic components of the skin, like when you're looking at different injections, right? You have collagen injections, hair transplants, all of that pretty much all happens in the dermis. Is that right?
Yeah, because those is where, like you said, all those oil glands are also there, right? That keeps the skin soft and smooth, but also, like you said, the hair follicles. Also, the sweat glands are there. A lot of the blood vessels that supply the dermis and supply the skin are in this middle layer. As we always heard also, I don't know if you guys did, but when I was studying and we learned that, that's why they say first, second degree burns are so painful, right? Because it actually right where the nerve, all the inflammation is right where the nerve endings are, and that's why it hurts so much. But once you get past third degree, right, you burn through that layer. It's not necessarily that it's not painful, but those burn endings those nerve endings are gone. You burn through them, which is sounds horrible, but then you're getting down to this. That's where you're getting down through this hypodermis, or the bottom layer of the skin. Whereas all the fatty we call it the fatty layer because that's where the cushion, right? That's the cushion, supplies the cushion. So the muscles, the bones, the nerves, all the blood vessels are actually kept from injury. So it's almost like a shock absorber. Also has a lot of connective tissue layers of skin down there, that's connected to the muscles and the bones. Also that same hypodermis also has protection layers for the nerves and the blood vessels that we talked about. And these nerves and blood vessels branch out to connect to the hypodermis and the rest of the body, and they go through that dermis. Also, that hypodermis is really important for regulating body temperature. And it's that fat in the hypodermis that keeps you from getting too cold or too hot, which is really interesting because people always say that, people always say, well, they believe that if you're, obese or if you're bigger, that you're always hot. But it's not necessarily true because some of that fat, sometimes it's deeper if it's in the actual organs, or it's visceral fat, right? Whereas whether it's here, not all that fat that we see is stored in the hypodermis.
And how much is that gender related? Because my mother, my wife, a lot of the women I know are always cold, and I'm always hot. So I don't know how that. Yeah,
and they're not necessarily thinner, right? No, right. So that's what you gotta say. There's other factors to that, but it just says it does protect. It is works somewhat almost like an insulation. Right, but it's not completely protective. I mean, if you're going to be in extreme temperatures, you're still going to suffer just like everybody else.
And it seems like, some of that is maybe climate controlled, right? So we had a couple guests on the show from Washington, D.C., and they come down to beautiful San Diego and acclimate to our wonderful weather and then don't ever want to go back, right? I think Sean and Franklin and Dr. Chawla, right? All three of those guys came from the East Coast, and then their skin just kind of gets softer, more adapts to this great weather, right? So,
yeah, man, I wonder if that's true. That would be a great study, or maybe it already exists, to look at if the hypodermis, that fatty layer, actually shrinks when you're in, more temperate weather like here.
Right.
Right. I don't know if you know about that, Dr. Shah, or not.
It actually does, because weather really affects how the water level will stay in the skin, and especially that layer of our skin. So it does, and there are studies actually we can look at, and when we talk about skin again with a different angle, we can bring that up in our show.
Yeah. So I mean, to me, that's the skin, like I said, is still one of the most exciting and most interesting organs because there's just so much complexity, and we're talking here very superficially about what the skin really is. We're not going into too much detail because we want to keep it so that we're not boring you too much. But there's so many at the cellular level, and even at the chemical at the chemical level. There's so many reactions happening, and there's so many factors that go into providing a healthy skin that sometimes it's a wonder, right? So as we get into this next section, we're going to really go into all these conditions that, really affect our skin and why. And more importantly, to me, are they reversible or not? Because we've all deal with, obviously we've all had bug bites, and we've had sometimes, I don't know about you guys, but sometimes I just get a rash out of nowhere. I didn't, until recently, I didn't believe I didn't have allergies, or at least was evidence of any allergies in me And then all of a sudden in my 40s, I started developing allergies, and all of a sudden I have like a little rash or a little bump shows up somewhere. So I went to go see my doctor, and I was like, hey, I think there's something wrong with me. And he's like, well, what? And I give him the symptoms, I show them, and he's like, oh, you have allergies. And I'm like, no, I don't. He's I'm like, I've never had allergies in my life. Come on, I'm 40. I'm in my 40s now. He's like, yeah, you didn't have allergies before, but you do now. He's like, it's not out of the question. He's like, you can actually develop allergies at any age of your life for no reason at all. He's like, so welcome. And I was like, oh my gosh, it was devastating to me. But I'm sure a lot of people out there dealing with very similar issues.
The joys of aging. So as we return on the Healthcare Corner, we'll continue to talk about all these different types of things that affect our skin, and stay with us because you're going to want to learn more about what we can do to potentially reverse some of these effects.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah. Welcome back to Healthcare Corner, where you're a part of the conversation with your hosts, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.
So at the end of the last section, we talked a little bit about different types of skin conditions and disorders with the skin. Some of them, I think, are potentially genetic. Many of them are not, though, right? Like contact dermatitis or different blisters that we get from pressure ulcers, heat friction, that sort of thing. But skin cancer, is that something that is in your DNA? So again, I think as we kind of go through these different types of skin issues, because it's the largest organ, there's so many different factors that go into it. So I think we'll just pick one and go from there, right, Guillermo?
Yeah, I think we just go down some of the list and see, what are these common conditions that affect the skin. Some of the things we'll start with are things that you are all very aware of and that you probably deal with almost on a daily basis. I mean, at the end of the last segment, I talked about allergies. And now, Gavin was talking about things like contact dermatitis. Is this a real allergy? Sometimes we're just sensitive. I know you guys, we've all probably have come in contact with something that causes a local rash. So, sometimes I've had patients who come and they're like, oh, look, I developed like this specific patch right over my left wrist, my right wrist. And, it just came up all of a sudden, it's super itchy and bumpy and, man, I just can't stop scratching it, and it's just localized one spot. And I was like, well, usually when it's something like that that's itchy and bumpy, it has to be something you came in contact with just in that spot, right? They're like, no, I think it's something I ate. Well, if you would have consumed it, it probably would be systemic, right? Why would it just show up on your wrist? Like even without my medical degree, that didn't make sense. Right. But there's things like that. Like we've all very familiar. I don't know if you guys remember poison ivy, but as a kid, I grew up in a very rural area in the middle of a lot of agriculture, and it was all, trees and forests. And so we were always playing out in the dirt, like I talked about earlier. So I had multiple episodes of poison ivy, and sometimes I don't even remember coming in contact with it. Right. But it is one of the most excruciating rashes, that I can remember as a kid. And did you guys ever have poison ivy?
Yeah. Poison ivy, poison oak. Right. And we go on different hikes, like, up in Tahoe, we do a lot of vacationing up there, and so you'd learn about it. But even still to this day, it's hard to, I think, point out and really differentiate. So, but it was an awful experience.
Yeah, I don't know, but for some reason, when I was a kid, my family, they treated it with vinegar, right? And it was so like, I mean, I still like right now, it burns my skin to think about it. It was so, because it was a lot of these wounds, because you were scratching so much, they were open, right? And then you're adding like vinegar on these wounds, and I guess it would dry them out. I don't know, that was the theory. And I remember for days it would be like, my mother or my aunt or my uncle enjoyed torturing me, so he used to live with us, and he would love it, and he would say, I don't know how you keep getting these rashes, and I was like, because I'm always out in the middle of the woods, playing, and I just never learned my lesson. Yeah,
it was calamine lotion for us, right? That old pink stuff, and just rub it all over, which didn't affect me because my skin's so pink anyway, right? Like, but that's what we used back in the day.
Right. Yeah. There's also things like blisters, and like you said, most of those come from pressure, sometimes just friction. I don't know if you've ever like worn new shoes and they cause this blister on the back of your heel, and it's so painful too until they kind of pop, and it takes a while to heal. Those are common. So, those are really common. Obviously, bug bites that we're all familiar with, spider bites, tick bites, mosquitoes all the time. Like you alluded to skin cancer, things like melanoma, but there's also basal cell carcinoma, the squamous cell. There's all these different types of cancers, and those are multifactorial. It's not one insult that will lead to something like that, as all cancers are, but it is very common. More common than we know, and especially in certain pigmentation type of people, or lack of pigmentation, or people are exposed to really sun all the time without protection, obviously are more of a risk for skin cancers. There's also things like cellulitis you talked about. When we talk about the itises, we're just talking about inflammation, right? So any cellulitis, all it is inflammation of the skin. But what is it, right? There's many things that can cause a cellulitis. It can be a viral issue, right? Most of the time it's bacteria, right? Sometimes, you get that as a super infection with, we guys probably, because you've worked in the elderly community, especially at the skilled nursing level, and so have I. So you see a lot of people that end up with skin infections because their legs get so swollen, and then they get open wounds. So obviously the skin breaks, and then some of that bacteria that's already on the skin just gets introduced, and they get an infection, which they get cellulitis, right? So infection of the skin. There's a lot of also more common disorders in people as they get a little bit younger, or sometimes at any age. But acne is one of the big issues, right? Eczema, psoriasis, vitiligo. Most of these are things that we now associate with autoimmune disorders. Acne could be a combination of things, right? Is it really autoimmune? Is it really related to your microbiome and your gut and some of these hormonal changes that are causing it? I think it's really a multifactorial issue. But some people have very severe cystic acne and suffer severely, consequences that are lifelong from acne.
Dr. Shaw, what are your thoughts on acne? Is it something that can be controlled by our diet and exercise, or is much more to that than that?
So I suffered from acne as a teenager, and I was told that, your diet has nothing to do with it, chocolates don't matter. And I kept living my life as I would love to, because everybody who has sweet tooth, they love these things, right? And it was a hard path to finding out that it does matter, and there's your gut health involved, the gut microflora is involved, your skin type is involved, oily skin versus dry skin versus combination. There's so many factors involved in cystic acne that can lead to, teenager from adult acne, and then stress. What kind of stress you put in your body, and on, daily basis, what is the level of activity of different things that you are diving into from exercise. So many factors. I think that will really help us dive deeper into our fourth segment. And then, of course, we have an amazing new next week guest that's going to be talking about different microflora. So that's going to be really great to dive into.
Yeah, I completely agree with you. Acne is very complicated, and that is something that, like I said, it's more as we get into all these issues, but especially when it comes to skin, that we're going to always here at the Healthcare Corner promote really going into the root cause. And, like I said, there's always these topical, especially with acne, right? There's a lot of these topical cures or remedies that you see that you can buy. Some of them are pretty expensive, some are not cheap, some are not easy. And they're really good at treating superficially the symptoms of acne. And some are really good, some are not so effective. But really, with things like acne, like you said, like Dr. Shah just told us, is that it's very complicated, and that the root cause is something much more profound, and typically something that's related to your microbiome, and a lot of chronic inflammation that probably has changes, as we talked about here in other shows, changes your epigenome, changes the way your hormones are being regulated, and all that leads to this imbalance that leads to bacterial superinfections in your skin pores, and that leads to the severe cystic acne. So the answer to acne is a lot more complicated than some of these other things. But there's other things like we talked about earlier with Gavin. He's told you already multiple times he has a lot of freckles, right? So is freckling something that's an issue? Usually freckles aren't painful. Yeah. Some people actually believe that beauty marks, right? Their freckles are right, so they can be, it depends on those are on the eyes of the beholder, really. That's how I look at it. But there's still issues, and some people do have issues with just hyperpigmentation of skin. And that's related sometimes to inflammation as well, whether it's from sun damage. Most of the time it is from sun damage, right? The sun always affects us, and you end up with this, darker pigmented skins. And no matter what your skin color is, if I was lighter, I'm sure I would be, you could see that I have a lot of freckles. But there's also things like wounds and burns and scars and all these issues. And, so the key here is, are any of these really reversible? Huh?
And you look at some kind of like skin tags and moles and that sort of thing. And I know a lot of dermatologists that I work with back when that was my industry would freeze off a lot of different lesions, right? So, and some you could freeze off and some you couldn't. And so from an outsider looking in, it's kind of hard and challenging to say, hey, what is this bump? And where did it come from? Is it more of an allergy, a dermatitis? Is it, how do I address this? And so how important is it to, if you see something wrong with your skin, check into it and get a second opinion?
Yeah, you mentioned some things that are actually really interesting because they're really benign growths, right? You're talking about skin tags and moles and some of these things that, and most of the time, like those aren't an issue unless they're in an area where there's a lot of friction, right? So for women, any bra straps or anywhere where, like for guys, like a collar or something that you put on a t-shirt, or if you have skin tags, like sometimes more really the ones that I used to get a lot are people who have them in their neck or in their armpits, and they start, being really irritated and they would get inflamed. So those we would obviously try to remove. And I used to have we used to call them lumps and bumps clinic. And it was really fun because right? It was cool because, once a week, actually, I would just sit up. It was all procedures, and all I did was remove these lumps and bumps. So most of those were actually benign, right? Whether it was, like I said, skin tags or moles, or sometimes they were just lipomas that were under the skin, or sebaceous cysts, or things that could easily, in the clinic, just, you could do a fun procedure. That was back when, pain medicine doctors were allowed to do, little surgical things and have fun with it and actually get paid.
They had a larger playbook, right, than they do now.
Yeah. Now we're just glorified secretaries.
So, Dr. Castillo, is that leading to a question that this is a messenger that the body might be giving, and we need to kind of look a little more deeper from these benign growths?
Yeah. So, I mean, there's obviously something that led to those growths. So, whether it's, sun damage or actually excess pressure or some of those, like we talk about just with like acne, is it hormonal imbalances that lead you to be predisposed? It's probably a combination of all those things. So definitely depending on how aggressive these spots or how much they're starting to recur, then it could be a signal for something going underneath. But as Gavin alluded to, the most important thing is to really, to know the difference when something is really benign and something you don't have to worry about versus something that you need to take care of. And whether it, if it's irregular borders, you've heard of this before, starts growing really rapidly, the colors look funky, it starts draining, or, there's a central wound, it starts to bleed all of a sudden. Like those are things that aren't normal, right? So it's something to look into deeply. So, as we get back into the next segment though, let's go back here and really go over some of these conditions and, what's the root cause? And are they reversible or not? And what can you do to actually, have the improved and better skin health? We'll be right back.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah. Welcome back to Healthcare Corner, where you're a part of the conversation with your hosts, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.
Welcome back, everyone. And today, there's so much to talk about, right? It's the largest organ of the body. We've talked about a lot of different types of conditions and disorders. So I think let's maybe just go through that list, Mansi and Guillermo, and let's figure out what can be reversible, what we should look for. And then, as always, we'll get to kind of our tips and tricks and how to help our skin.
Yeah, absolutely. I'm all for that. So yeah, like we talked about the show, the topic of the show today, was it reversible or not? You know, there's a lot of insults, there's a lot of things that happen with our skin. And let's just go down the list and see which one of those are reversible and how can we reverse them. So we start with allergies. Would you guys guess that allergies are reversible or not?
Reversible.
I would say reversible.
Yeah. So it seems really easy, right? Very intuitive. If you're allergic to something, how do you get rid of that allergy reaction? Get rid of the allergen. Remove the allergen.
Yeah, it's a trigger.
That seems very straightforward, right? Burns. Do you think that burn damage is reversible or not?
No.
It depends, maybe, right, on the severity of the burn.
Well, severity, yes, absolutely.
You can treat a burn, right? If it's first degree, like I said, second degree, depending on how severe the burn is. Yeah, you can treat it. You can reverse the actual burn, but sometimes depending on how much inflammation is left behind, there's going to be some scarring. I have a lot of burn scars. Right, there's a lot.
I have a few too from my bike. So yeah, I guess we could reverse them to a certain extent depending on how severe they are.
Yeah. What about infections like you get rashes, blisters, and bug bites? You think those are reversible?
Maybe.
I would say for the most part, right?
Yeah, I think so. They kind of go away and recover, right? For the most part.
Yeah, like I said, most rashes and little bug bites here or there, you treat them, the inflammation goes away, and you get better. And like I said, some of us, this is a good time to talk about this. Some of us are more predisposed to post-inflammatory hyperpigmentation. You get people will come to me all the time and be like, "Hey, doc, I had this like bug bite, or I had this little rash, and now I have this dark spot or this little spot here." And I'm like, well, how long ago was it? And they're like, well, it was about 3 or 4 weeks ago. I'm like, well, it probably get lighter over time. And sometimes because some of us just do deposit pigment because of the inflammation, so somehow it activates those melanin cells and you just get a little bit more pigment there. So, sometimes you can treat with a little bit of steroids, just a few days, no more than every 5 days because it will thin the skin, especially on the face or things like that, and then it's easy. You can lighten those up. So yeah, for the most part, they're reversible. But like I said, if you have long time inflammation, you could also end up with scars. Yeah. What about autoimmune conditions? Rashes and eruptions from autoimmune conditions. You guys think those are reversible? It's
a bit complicated, right, Gavin? With that.
Yeah, I'm going to leave it to both of you on this one, but for sure, I'm going to agree with you, Monsi. Yeah. Absolutely.
Yeah, there's all these conditions. Obviously, with lupus, we're familiar with this malar rash, and there's also, all myriad of, even with thyroid disorders, you can get some hyperpigmentation of the skin. And if you treat the underlying issue, it gets back to that whole root cause, right? If you can really get down to the root cause, and reverse that, and you could definitely improve. And a lot of times completely get rid of those skin issues that are associated with that. What about rashes or wounds? Sorry. So when you have say like a cut or, like even if it's a blunt trauma and you have these wounds, or like you said earlier, you have these big wounds from pressure ulcers or things like that. Do you guys think those are reversible?
Well, I'm looking at a wound right here on my finger that happened 20 years ago, and it's still there, right? So maybe, but hasn't been my experience.
Yeah. Well, what do you think, Monsi?
I would say, Dr. Castillo, with newer technology and skin grafting, it's different now. My brother is a classic example. He always, gets big cuts and bleeds and has wounds, and he's had it on his face a couple of times, and you can't tell now, but if you look closely, you could point it out. So I would say it was more of a really good doctor who did grafting on it. So I think it's all, again, depends kind of an answer on that.
Yeah, I agree with you. Yeah, they are reversible, right? There's some surgical techniques now and even some laser therapies and that are minimize scarring and can, almost make it so light that it's really hard to distinguish unless you get up close, right? But some of these things are very sometimes costly, and some of these things are not considered medically necessary. So you do have to usually pay out of pocket for some of these procedures. But yeah, you can reverse some of these, right? Obviously, if it's a huge wound, you had a big abdominal trauma or something, and they opened you up from the pelvis all the way up to your sternum, it's going to be hard to fix that. Right. There's some people who have some scars, and sometimes these wounds remind us of of the bad decisions that we made. So sometimes it's not good to get rid of these guys. It's good to have a little reminder there so you don't repeat it,
Right?
Because we're really good at ignoring those things. So like I said, these are the common things that happen. Obviously there's also, like I said, skin cancers that we didn't talk about. Are those reversible? Yeah, some of those are treatable, right? Some of those we can treat the actual skin cancer and over time, but they're not completely. You can't completely get rid of them. There's just some of these cancers, like a basal cell, for example, are cancers that you probably live with and probably never kill you, but it's always going to be there, right? But then there's other things like melanoma that you just can't get rid of, and those can be very serious.
Absolutely.
That's it.
So let's get to the segment where we can really help our people right away with implementing some of these really cool, options for their skin health.
Yeah, I'm with you on that. So as we've talked about today, our skin is the largest organ. And as we know, there's 3 different layers to that skin, and there's different components of those layers. So, and we've talked about how important it is because what it does for us, how protective it is, and how essential it is. Most of us cannot live without skin. They said about, skin is so important when it comes to improving not only thermal regulation, but also hydration of your body, maintaining the liquid or the water in your organs and the skin. It stays in because of the skin is in there. So I remember studying when I was doing that burn rotation, and they said, what's the longest somebody can live without skin? They said about 3 days. The best of us would probably last about 3 days before we would just, the hydration imbalance would be so off that, your electrolytes would be thrown off. You'd have organ failure. So you would die. You would die within 3 days if you didn't have any skin. So it is an essential organ. So what can we do, knowing that now? What can we really do every day on an everyday basis to really help ourselves? Have the healthiest possible skin. Right? And this is the question. So what would you think the number one thing is, Dr. Shah, to improve your skin health? The easiest thing, also.
Easiest number one thing I would say is drink clean water.
Yeah. Hydration. Exactly.
Hydration is everything.
As we talked about, more than 80% of our cells are composed of water, right? So it's very important to have enough hydration. And like you said, not just any hydration, but healthy, right? Having all those electrolytes and everything in balance really helps.
And having that exercise, right, to be able to get the water into the cellular level too, right? I think that we talked about.
Yeah, I think, obviously exercise always helps. I think the exercise really helps with maintaining good hormonal balance. And all that hormonal balance is really important to making sure that the cellular shifts, right? That everything is working at the cellular level. That brings us into the next one. Dr. Shah, go ahead. Tell us, what do you think next we should do?
I would say also using sunscreen, which is more on the organic side because we want to protect our skin from sun damage, but also want to make sure that we use something very simple like zinc oxide and not too many chemicals for it.
Yeah, that's a really important topic. We could do a whole show on just that topic alone because
I could have a whole month of episodes for that topic for sure.
Because there's a big controversy now about how much skin protection is good, because one of the big, as we talked about here, we had a whole show on vitamin D deficiency, right? And they're saying that most of us these days are not getting enough sun exposure, and that's part of the reason that we have a big vitamin D deficiency. So does having so much barrier protection on your skin impede you from getting enough vitamin D, enough sunshine to create that vitamin D? I don't think I've read enough studies to understand really what the impact of that is. But what I do know is that depending on your certain predisposition, genetic, and like I said, your skin pigmentation, that some of us are just at higher risk of sun damage. So we have to outweigh the risks and the benefits. Right? If you have multiple family members who've had skin cancers, or you've had family members who have had melanomas, or you've had a genetic test. Nowadays, a lot of people have genetic tests that says you are predisposed to developing a melanoma. Guess what? I'm not going outside in the sun unless I have plenty of protection. I feel, a hat and long sleeves and gloves and
sunglasses, the whole nine.
Yeah.
So just to kind of tease out next week's show, we want to talk about the microbiome. And so did I hear you both right that the skin has its own microbiome as well?
Absolutely. And it's individualized also. So everyone's own microbiome is different.
Yeah. And, we've talked about this on the show about the microbiome. And next week we'll have Dr. Joe Feurenstein back, and he's the expert on the microbiome, but we'll really get into, the complexity of that microbiome in the gut. And if you remember from what we learned in biology and probably medicine, the skin and the gut is basically comprised of all the same cells. And it's just basically, if you think about your gut, it's almost like your skin just enveloped inside. Obviously there's a little bit different of the mucus and everything that's needed for digestion, but theoretically that bacteria all came from the same place, right? We all got our microbiome and our bacteria on our skin initially and in our gut from as we came out through the vaginal delivery and our mother's vaginal secretion. And then over time, obviously your environment leads a lot to that. So you end up with this incredible microbiome. So that means that our nutrition is very important, right? At the cellular level, metabolically, we have to be in tune and have healthy microbiome. And I think next week we're really going to cover some of these topics at a much more in depth, and will really give us an understanding of what we need to do for that.
Absolutely. And I would honestly want to close out with high antioxidant foods that are really protective for skin and gut microbiome. So I would say berries, go for all the colorful fruits and vegetables, and that would be great to start using right away.
So I think it's a topic that we're only scratching the surface on, right? We've only gotten skin deep here. So definitely next week we'll learn more. But as always, we're so grateful to have you here on the Healthcare Corner. Listen each week and make sure that when you like and subscribe our show, that you share it with other people that might benefit from the knowledge of Dr. Shaw and Dr. Castillo. So we really want you to be better consumers of your own healthcare information, what's out there and what you can do to really be informed. So come visit us at hcshow.net, and we hope you have a wonderful weekend here in the Healthcare Corner.
Yeah, see you next week.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner.